When people are doing a hip flexor stretch, like so, they get into the hip flexor position and they start arching their back. And so they get that shooting pain down into the leg. That is not something to push through. Now, the reason why, just for those of you that don't know, the reason why the forward bending feels nice and so many people get caught in this trap is as you bend forwards, you open up the spaces here where the nerves come out. And that creates more room. It creates that temporary amount of relief while we're doing it, but it comes at a cost. You're squashing down more on the front of the vertebra here, and that's creating more strain on these ligaments that are trying to heal and tighten back up. So you want to make sure you're avoiding that kind of stuff. Understand that the vast majority of you guys with lower back pain and or sciatica are going to have injuries at the level of L4-5 and L5-S1. That is these last two sections down here in the lower lumbar spine. The one between L4 and L5 and L5 and S1. These junctional areas are the areas that respond for like 90% of lower back injuries. 90% of your sciatica is coming from those sections, probably a little bit more, I would say. Is it possible to have a herniated and bulging disc with no sciatica? Yes, it is perfectly possible for you to have a bulging disc without sciatica. Many people will have a bulging disc and they might just have lower back pain. They might just have buttock pain. They might just have a bit of tingling in that big toe. It really does vary.